So first we're going to be evaluating the ear. We have Courtney with us. We're going to be inspecting her ear. First what I'm going to do is I'm going to go to the side. I'm going to be looking at Courtney's ear. I'm looking at the pinna. I'm looking at the tragus and the antitragus. I'm looking for any swelling, inflammation, just the skin, the coloration, any scaling or any excessive earwax. I don't see anything. Now we're going to go into palpation. I'm just going to view the other side to make sure. And everything looks good. Next, what I'm going to do, we're going to do palpation, accessing for first if there's any acute or chronic otitis externa. So we're going to go to the tragus. I'm just going to palpate on the tragus. Any pain there?
No.
Any pain there?
No.
And then I'm going to just pull on the ear as well. Any pain there?
No.
Any pain there?
No.
Next, I'm going to palpate the mastoid to see if there is any mastoiditis. Any pain there?
No.
Any pain there?
No.
Okay. Now that the outer inspection's done, I'm going to use my otoscope and look at the inside of the ear. Just before I look in, I'm going to be telling you I'll be observing the umbo, the malleus, looking at the cone of light, making sure it's anterior and inferior to the umbo. Also looking for earwax production, making sure it's not black or old, making sure there's a good yellow hue to it. Also making sure there's no any other debris or buildup or any swelling of the tympanic membrane or any redness or discoloration of the tympanic membrane. Good, and everything looks really good there on that side. Everything's normal. And again, just to clarify, I'm pulling the earlobe out, back, and anterior. And I'm going to switch speculums, make sure we're throwing the tips out. We're not going to transmit any mucous membrane into the other ear. And again, that looks really clear. No redness, no swelling. Everything looks normal. Next, we're going to go to conduction test. So first, I'm going to stand behind Courtney, and I'm going to first see if Courtney can hear correctly. So can you hear this?
Mm-hmm.
Can you hear this?
Mm-hmm.
Okay. So now what I want you to do, I want you to plug this ear for me on the side. I want you to close your eyes for me and let me know when you can no longer hear this.
No.
Okay. Now again, let me know when you can hear that.
No.
Okay. I'm going to go on this side. Yep, plug that in here. Thank you.
No.
Okay, let me know again.
No.
Okay, good. Relatively normal on both sides. For a typical exam, you would stop here, but we're going to continue. We're going to go to Weber's test, okay? So all we're going to do here is I want you to tell me if you hear, if the vibration or the sound is stronger on one side of the ear or to the other, or if it's equal.
I can hear it on both sides equally.
Okay. And again, I'm using a 512 hertz tuning fork. And if it was conductive, she would come in saying that she has almost like fluid buildup, or feels like she can hear herself echo. And on that, the ear that has the conductive hearing loss will be louder, so that would influence conductive. If it was sensory neural, she would complain of just not being able to hear anything, and when I would do that test, it would go to she'd be able to hear it louder in the side of the good ear. That would be sensory neural. So next we would go and we are going to do Ryan's test. So what this is going to be is I'm going to do the tuning fork. I'm going to put it on the back of her mastoid. She's going to indicate to me when she can no longer hear that, and I'm going to place it 2 inches from the side of her ear, and she should be able to hear that.
Okay. Yeah, I can hear it better now. Okay. Much louder.
Okay. So that's normal on that. Then the last one we're going to do is going to be, again, listening for the tuning fork and differentiating between conductive and sensory neural. On this, there is a little bit interpretation between the doctor's hearing ability, but if the patient hears the tuning fork and when the doctor brings it up can't hear it, that would indicate conductive hearing loss. If the patient can no longer hear the tuning fork and I bring it up and put it to my ear, it would indicate sensory neural loss.
Okay.
And I'm not able to hear it either. So indicating everything is normal. For the sake of time, I would do the same exact thing on the opposite ear to make sure that there's no conductive or sensory neural loss. And that is the examination.